You're very welcome back. Now, while most of us tend not to think about healthcare until we're sick, our next guest is a consultant that says that our well-being is something that we need to think about every day.
Her big message is to be proactive rather than reactive, and she is the director of the wellness program at the Mater Private, and she is passionate about self-care. Maura, great to have you on the show. Maura, is there a misconception about what being healthy is?
Yeah, absolutely. Just before I came in, I Googled health. And Google will tell you, Dr. Google will tell you that health is the absence of disease. But actually, if you go further to the WHO, the World Health Organization, they'll counter that and say health isn't about the absence of disease. It's actually wanting to be in the state of optimal well-being and physical health, irrespective of whether or not you have a diagnosis. And we all know that. It's not black or white. You're not healthy or unhealthy. You are, if you're really lucky, you're well and you don't have any health problems, and hopefully you won't have any and you'll live until you're 99 and a half. But for most people, they can be well and maybe at risk of something, but a lot of people will have been born with a disease or born with something or diagnosed with a chronic illness, and that's the more the reality of it. So health is your state of being, no matter what it is. And I guess the idea with wanting to manage that health is to make it a little bit better if you can.
So focus on the reality.
Focus on the reality, and that's why we try and change the terminology just a little bit and make it a bit more realistic. So medical wellness now is another term or another label that we're using, and it's to try and soften things a little bit and say, you know, medical wellness is about trying to say to people, look, your health is what it is, and let's try and encourage you to get into that space of participating in that health and try and promote your health, promote good health, and hopefully prevent disease, because ultimately we should strive for that, to prevent disease, and prevention being much better than cure.
Okay, on that note of prevent disease and on the aspect of self-care, should we treat ourselves almost like we treat a good car and have regular checkups?
Yeah, it's funny you say that, because that's often what we'll say to people. Look, you schedule your car service twice a year, you'll go for your NCT, you'll make sure that, you know, booking your haircuts or whatever it is.
Yes.
But no one really says to themselves, I'm going to schedule in a little bit of time for myself to say, where am I at, and take stock with it. A lot of people will actually just put it on the long finger, and they think of their healthcare management as just that time that they say, okay, that symptom isn't going to go away now. I really will have to go to my GP.
So after
or
around
that
3
time.
months of waiting,
yeah, exactly. You know, and you know that's true for so many different
it's
things.
Like if you had a puncture after 3 months, oh my God, that
be a bit tricky to drive around.
But then again, when it comes to car, and I heard this when it comes to mental health and well-being. For example, if you're driving in your car and one of the yellow lights come up, right, you'll actually go straight into the garage and get it fixed. And when it comes to well-being, there's something wrong. We don't.
No, and there's a lot of really interesting data about that. Like if you look, there's an interesting report now on workplace health and well-being in the workplace, and this is in an Irish cohort of patients, where 30% of them will say they ignore their symptoms for at least a week. People will say that they put off going to their GP. 88% of people will say that despite having symptoms or feeling unwell, they'll still go to work. And if they do go to their GP and their GP makes a recommendation about perhaps you should take some time off, they will still go to work. You know, and that's true in just that's a sampling of a cohort of patients in work. But how about the people at home caring for others, or busy mums constantly put their own health on the back burner?
Actually, I was reading, is that the same stats there that says over 50% can have burnout then?
Yeah, and burnout is such a reality, you know, and burnout is something that at least now we have a label for it or a name for it, and it's in the conversation and we can talk about it, and there's a role for occupational health and so on and so forth. But burnout is really very real, and in so many cases potentially avoidable by both, if we take on a responsibility not just of the employer, you can't always blame the employer, but also the employee. So that person, and taking that time out to take stock of your own health and where you're at.
But burnout seems to be linked to wellness directly, though, is it?
Well, yeah, I mean, they're all kind of words that are thrown in together, and then often, you know, I guess they're common words that we hear all of the time, but you know, the true definition of burnout is in the workplace is just sheer exhaustion. People are exhausted, and then that takes away from how they're able to function at work and interact at work and provide that service. And ultimately, it's poor work performance and then disconnect. So that's a real workplace form. But you can bring that idea into, you know, even the home. People who are just working at home, minding kids, trying to balance. Everyone then will kind of probably realise, I'm a bit burnout. I'm simply tired.
Yeah. Should we go once a year? Should we go and have a full medical check? And what should that check be? Is there a checklist that we should go through?
I think, yes, there's all of those things. But actually, I would take it back a step.
Okay.
And I would say that managing your health and your medical wellness should be about the little things that you can do every day. It's not just about that traditional model that your health care is what's managed by your GP or the hospital. Okay. It's actually all the little things in your day-to-day that you can try and think about and develop good habits to try and prevent disease or improve your outcome if you do have a chronic disease.
Where would you start with something like that, Mary?
Well, there's loads of examples, and it all boils down to, on a day-to-day thing, the fundamental good habits. And the really simple things, like you throw out the term lifestyle medicine to people and they suddenly think it has these connotations. So that's fluffy. For people in their teens and their 20s and the millennials who are all doing spinning classes at 5 a.m. But it's everybody. So it's diet, it's exercise, it's sleep, it's smoking,
back to basics
it's
again.
Alcohol. It's back to those really simple basics. And if you look at chronic diseases, no matter, you know, the list is so long. So think about cancer. We do know that approximately a third of cancers diagnosed could potentially be avoidable with positive lifestyle change. We know that diabetes, really common disease in Ireland, that can be avoided or reversed with diet and exercise. Osteoporosis, bone health, osteoarthritis, cardiac disease, you know, mental health. The list is endless of all of those chronic diseases that either could be prevented or improved if we go back to basics and think of the little things that we do every day and try and make a simple change.
On a daily basis.
On a daily basis. Yeah, because it's all about habits. Mm-hmm. And if you can develop healthy habits, that will give consistency and then hopefully sustainability. And it's not easy. I mean, I feel like a total hypocrite sitting here today because we all don't do it.
We're all busy.
But at least then you could empathise and say it isn't easy, but actually the simple things will make it better.
And that's what you're promoting. Go back to basics. Do your, you know, half an hour walk 3-4 times a week. That kind of stuff. Eat well.
But even half an hour walk can be a lot for people. You know, exercise is about moving. Do you move? Yes or no? If you don't move, move more.
Mary,
do you take the lifts? Take the stairs.
Yeah. You'll have to come back. Certainly come back to us to discuss it. Thank you so much, Mary, for coming in. Now, and if you want to get working on a 2020 health plan for yourself, you can check in, of course, with your GP, or you can visit hse.ie.
We're going to start this moving, Maura. We've Eunice Power in the kitchen.
I know, but we're all sitting here probably talking about it.
Very healthy. We've Eunice Power with us in the kitchen after the break. We'll see you then.